With everything currently going on, it can be a little bit difficult to look at anything that's not 5 feet in front of our face. But in the interest of continuing to look forward, I want to talk a little bit about healthcare. Some of the founding principles of this country are that we have the right to life, the right to liberty, and the right to the pursuit of happiness. And we all know that our country has never been perfect at living up to those founding promises, but one of the best features of the United States, and more specifically of its people, is that all throughout our nation's history, there have always been people willing to push us all to be better. People with the desire and commitment to force us to keep improving until we can finally live up to those promises. And I don't think we can say that a person truly has the right to life if poverty continues to be a barrier to access to healthcare. As a country, we still have a long way to go before we can say we fully lived up to that particular promise. Far too many people are still uninsured or underinsured, and far too many others are paying huge chunks of their paychecks for imperfect, inconsistent insurance coverage and running into denied claims or unexpected bills for services that they thought their plan covered. And now we've made progress. More people have insurance now than used to. And as a result, fewer people are dying from a lack of access to care. But there is more work to be done. In Illinois, we've been leading the nation on some very important healthcare reforms. Mental health care is no longer subject to prior authorization. Insurance plans are required to cover far more conditions and injuries than had been covered. We're working to bring prescription drug costs down and to better regulate pharmacy benefit managers. We are enshrining coverage for reproductive health care firmly in state law. We are reviewing more proposed rate changes to ensure they're both actuarially sound and necessary, and not just being done so the insurance companies can make a larger profit. We can thank strong progressive leadership in Governor J.B. Pritzker and strong progressive leadership in the Illinois House and the Illinois Senate for that. Not to mention the dozens upon dozens of advocacy groups, shout out to the People's Lobby, that are helping to make it happen. There's still more work to do, though. Around 6% of the Illinois population do not have health insurance. That is below the national average, but that is still too high. We don't have perfect data to calculate the underinsured population, people who are paying for high deductible plans and otherwise paying for plans that do not meet their needs. And with the cuts the federal government is making to both Medicare and Medicaid, the number of vulnerable people in need is going to continue to go up. Now, it's long past time for universal access to healthcare, and we can do that with our state-based exchange. We should not accept anybody going broke because they injured themselves or got sick. And a public option, if you will, through the state-based exchange is one way we can address that. And now, I'm often not a fan of using competition as a theory of change, but it may work here, at least in the short term. Medicare is significantly more efficient than private insurance companies, and there is reason to believe an Illinois-based public option would be too. Let private insurance companies, where actions are guided by denying coverage where possible and making as much profit as possible, compete with a state-run program where decisions are guided by covering as much as possible and making access to healthcare as easy as possible. I think the moral argument behind this is pretty obvious. Illness is not an indulgence, nor is it a crime. So getting sick or injured is not something that should be punished, and treatment isn't something that should only be accessible to the rich. But beyond the moral arguments, I think there's a pragmatic argument here as well. People who get sick enough to need to go to the hospital can't work. And if they're forced to come into work anyway, if what they have is contagious, they will infect others, and the problem escalates. If this is a person who works in an industry like food service or retail, the number of people they could infect is enormous. Our economy will suffer, our tax revenue suffers, and the quality of life for everybody suffers. Any tax dollar spent making sure all people have access to healthcare is a dollar spent to ensure that none of those bad outcomes happen. And any dollar a person does not have to spend out of their personal funds on healthcare is another dollar that can be spent on something like education. And as a brief aside, I think we should make education far more affordable, if not free as well, but I can save that for another video. And if the public option is good for patients, more people will want to switch to it, and private insurance will have to improve if they want to compete. Every individual person will gain. We all benefit from a healthy population able to fully and completely engage with each other. We all benefit from an educated population able to engage not just with each other, but with the world around us. Removing the inequities in the healthcare system and creating universal access to care brings us another step closer to doing both of those things.